Good evening. Good evening, everyone. A very warm welcome to all of you. आप सबका हार्दिक स्वागत है for the classes. So yesterday we have started with discussion regarding diseases, right? So आज हम देखेंगे कुछ लाइफस्टाइल डिसऑर्डर्स के बारे में. अगर हमारा जीवन शैली अच्छा नहीं है, ठीक नहीं है, तो we tend to suffer from some diseases जिनका कारण है अपना wrong lifestyle. So yes, we will talk about lifestyle disorders today, right? Yes, good evening all. Yeah, lifestyle disorders. When our lifestyle gets disturbed, lifestyle disorders start to appear. जब हमारा जीवन शैली अच्छा नहीं होता है, खराब होता है, we have a wrong lifestyle, तो lifestyle disorders will start appearing. So आज हम 3 ऐसे जीवन शैली न सही होने के वजह से होने वाले डिसीजेस के बारे में जानकारी लेंगे. 3 diseases. One is obesity, second is hypertension, and third is diabetes. Yesterday many of you were asking me to talk about this hypertension. Yes, we are doing it today. Okay, so obesity, though we have seen some part of this obesity yesterday, आज हम अति detail तरीके से we will see, right? Obesity is a complex disease that involves an excessive amount of body fat. So obesity को हम आयुर्वेद की परिभाषा में स्थौल्य ऐसे बोलते हैं. संस्कृत में स्थौल्य तो एक बहुत संकीर्ण जैसा व्याधि है जहां पर ज्यादा मेदस हमारे शरीर में बहुत बहुत ज्यादा होता है नॉर्मल से. अपार्ट फ्रॉम बीइंग ए कॉस्मेटिक इश्यू, इट इज अ मेडिकल प्रॉब्लम. सो वो सिर्फ देखने के लिए अच्छा नहीं होगा ऐसा ही नहीं, इट इज अ मेडिकल प्रॉब्लम. क्योंकि जो भी लोग ओबीस रहते हैं उनके बहुत सारे प्रॉब्लम्स हो जाते हैं, लाइक हार्ट डिसीजेस या हृदय रोग, डायबिटीज, हाई ब्लड प्रेशर एंड सम टाइप्स ऑफ कैंसर्स, राइट? देन in Ayurveda, atisthaulia या obesity is described as excessive accumulation of medas. So आयुर्वेद में अतिस्थौल्य के कारण हम जुड़ सकते हैं मेदस की ज्यादा होने से. दैट इज मेदस इज अ धातु टिश्यू एलिमेंट, और मांसा, मेदस और मांस की ज्यादा होने से ये ओबेसिटी हो जाता है, लीडिंग टू flabbiness of hips. Flabbiness of hips means the sagging of all these, या फिर too much accumulation of fat in these regions, which are the hips, abdomen and breast. Hips इसके लिए बोलते हैं स्फिक स्तन उदर लंबनम. Sphic is the hips, stana means the breast, and udara means abdomen. ये सब organs में fat accumulation होने की वजह से that is one important sign of obesity. It is considered as one of the santarpanotha vikaras. So there are 2 types of diseases. One is santarpanotha, other is apatarpanotha. संतर्पणोत्थ विकारास के कारण है कंजम्पशन ऑफ एक्सेसिव कैलोरीज. ज्यादा नरिशमेंट से we tend to fall prey for the संतर्पणोत्थ विकारास, and कम नरिशमेंट से ये apatarpanotha vikaras would set in. So santarpanotha vikaras are due to consumption of excessive calories. Then medodushti, that is disorders of fat metabolism. This is one of the main reasons, is one of the risk factors of ischemic heart disease, that is IHD. IHD के लिए ये एक बहुत important सा कारण होता है. And then causes, although there are genetic, behavioral, metabolic and hormonal influences of the body, influences on body weight, obesity occurs when one takes more calories than he actually burns with the daily activities and exercise. So इसके लिए कारण है सिर्फ ये जेनेटिक नहीं, सिर्फ ये बिहेवियरल नहीं, सिर्फ मेटाबॉलिक नहीं, ये सब तो इन्फ्लुएंस करते हैं हमारे बॉडी वेट पर. लेकिन ज्यादातर हम देख सकते हैं कि अगर लोग नॉर्मल से अपने रिक्वायरमेंट से बहुत ज्यादा कैलोरीज कंज्यूम करते हैं, लेकिन उतना कैलोरीज बर्न नहीं होता है उनके दिनचर्या के वजह से, this may be because of lack of exercise and daily activities and all these. So these are the causes. So lifestyle choices, unhealthy diet. So diet में बहुत ज्यादा कैलोरीज लेना, डाइट में फ्रूट्स या वेजिटेबल्स की कमी होने से, फास्ट फूड ज्यादा लेने से, एंड हाई कैलोरी बिवरेजेस एंड ओवरसाइज्ड पोर्शंस लेने की वजह से, we tend to become obese. Liquid calories, people drink many calories without feeling full. देखिए एग्जाम्पल्स है some soft drinks या cool drinks, all these, and from alcohol, people drink many calories without feeling full, especially calories from alcohol and high calorie beverages such as sugared soft drinks also contribute to significant weight gain. Then inactivity, activity कम होने के वजह से, so sedentary lifestyle, one can easily take in more calories every day than they actually burn through exercise and routine daily activities. So अगर हमारा activities ज्यादा नहीं है तो भी हो सकता है obesity. Looking at the computer या tab and phone screens is a sedentary activity which we all are addicted to in the present day, isn't it? The number of hours you spend in front of a screen is highly associated with weight gain. So that should be reduced. That is most important. Then overeating and irregular food habits. So zyada khana or food लेने का कुछ ठीक टाइमिंग्स नहीं है तो भी ओबेसिटी हो सकता है, राइट? सो ऑल दीज, डे टाइम स्लीपिंग, इसलिए हम बोलते हैं दिन में कभी भी मत सोना, अनलेस देयर इज some vayu or pitta related problems, do not sleep during day. Symptoms are breathlessness even on little exertion या physical activity. So that breathlessness may be one cause, and then one symptom. Lack of interest in doing work. So कभी कभी हमें कोई भी काम करने में इंटरेस्ट नहीं होगा, so that may be one reason. We feel lethargic, lazy. Then profuse sweating with foul body odor. So क्योंकि आप सबको मालूम है कि on the second day we have discussed that मेदो धातु, that is adipose tissue, ये धातु का मल, that is by product है sweat. So profuse sweating is seen with foul body odor. And then वो दुर्गंधता होता है ये मेद की वजह से. Excessive hunger, ज्यादा भूख लगता है. Feeling of tiredness. Then excessive sleep. ये सब तो symptoms है ये obesity का. And then diagnosing overweight या obesity. Overweight and obesity are assessed using body mass index या BMI. It is defined as person's weight in kilograms divided by square of his or her height in meters, kg per meter square. अगर आपको अपना height and weight मालूम है तो convert that into kgs, weight into kgs and height into meters, and you can calculate your BMI. Healthy and normal BMI is 18.5 to 24.9. BMI of overweight is 25 to 29.9. BMI of obesity is 30. So please try to assess your BMI. Then इसके साथ देखिए waist circumference should also be used in addition to BMI to measure central obesity and disease risk in individuals with a BMI less than 35 kg per meter square. So that is also very important. देखिए अगर आपका BMI 30 से कम है, ज्यादा है, 35 से ज्यादा है, all these. Normal range of waist circumference in men is 94 to 102 centimeters, whereas in women it is 80 to 88 centimeters. Then further following lab investigations are recommended to assess the risk of other health related problems. So which are all the investigations that are advisable? Lipid profile, blood glucose, both fasting and post lunch, preferably fasting, and then blood pressure. So these have to be seen properly. Ayurvedic management or line of treatment under strict supervision of registered Ayurvedic physician, this has to be done. Shamana या palliative treatment में langhan, that is fasting, आमपाचन, oral use of digestives to augment the fat metabolism. देखिए ये लंघन जो ये यहाँ पर बोल रहे हैं, it can also refer to intermittent fasting. Intermittent fasting is fasting for long hours and eating window is for few number of hours. For example, to start with, it can be 12 hours of eating window, 12 hours of fasting. Later it can become 10 hours of eating, 14 hours of fasting. और इसके बाद 8 hours of eating, 16 hours of fasting. And then further, some people, they have tried with this, what is this, 18-6. And then like that, 24 and all, it's there. But for our normal regular routine, I think 16-8 are, this is the one that we can follow. Okay, please try to learn more about intermittent fasting. देखिए ये क्या होता है कि ये फास्टिंग के टाइम में जो भी शरीर में अनवांटेड सब्सटेंसेस का उत्पत्ति होते हैं, all those will be properly what to say, made inactive, and it will be just discarded. So इसलिए this fasting is actually very beneficial. And then amapachan, that is oral use of digestives to augment the fat metabolism. Ruksha udvartan, that is dry medicated powder massage. Heavy and non-nourishing diet items like honey, salad, etc. are advised. Then physical exercises, mental work is also recommended. Physical exercises के साथ क्या होता है, सिर्फ फिजिकल एक्सरसाइजेस करके आराम से रहना कोई भी कमिटमेंट नहीं है जीवन में, ऐसा हुआ तो भी प्रॉब्लम है. सो फिजिकल एंड मेंटल वर्क बोथ आर इम्पोर्टेंट. संशोधन चिकित्सा, that is purificatory procedures, that is panchakarma, like vamana, therapeutic emesis, virechana, that is therapeutic purgation, lekhana basti, that is medicated enema. These are advised in management of sthaulya. And then samshodhana chikitsa, that is purificatory procedures. Panchakarma में वमना, विरेचन, लेखना बस्ती, same thing is repeated once again. So आप सबको वमन का मतलब मालूम है, विरेचन का मतलब भी अब मालूम है. लेखना बस्ती is medicated enema, जहां पर हम कुछ medicines को use करते हैं which are fat burning, which also help in proper fat metabolism, right? Then single drugs like guduchi, vidanga, musta, shunthi, amla, vacha, daru haridra, gugulu, etc. All these are used. Then compound formulations like trikatu, navaka gugulu, trifala gugulu, vidanga churna, takrarishta, navaya saloha, arogya vardhini vati, medohar gugul. These are all very, very effective, efficacious medicines which can be regularly used. And then लाइफस्टाइल मॉडिफिकेशन, लेकिन इसका डोसेज और इसका एडजुवेंट्स ये सब आपको थोड़ा सा आयुर्वेदिक डॉक्टर के को कंसल्ट करके ही लेना अच्छा होगा. Lifestyle modifications such as mild to moderate exercise according to individual capacity is advisable. Regular habit of brisk morning walk for 30 minutes is advisable. Avoid sedentary habits, avoid excessive sleep, and then avoid watching TV while having food. क्योंकि हमें पता ही नहीं चलता है कि हम क्या खा रहे हैं, कितने खा रहे हैं, right? So all those have to be reduced. And then avoid alcohol and smoking, those who are accustomed to it, addicted to it. Avoid sleeping just after meals. वो खाना खाने के बाद immediately सोने से, yes, fat gets accumulated in the body. What are the do's? Take low fat and low calorie food items. Take more proteins to stay longer without food. So proteins zyada khana acha hoga in the form of cereal, the grams, dals and all for vegetarians. Also paneer, milk, green leafy vegetables and fruits. These are also very good sources of protein. For non-veg, there are many options. Steamed or boiled or baked vegetables rather than fried are very good. Take frequent small meals to avoid food cravings. So that is advisable. Then drink skimmed milk instead of whole milk. take healthy food. Just a minute. Take healthy food such as oatmeals, walnuts, salads, bitter gourd, karela, drumstick, then barley, wheat, green gram, honey, Indian gooseberry, pomegranate, and snake gourd, etc., and skimmed buttermilk. Include cabbage in daily meal because it will stop conversion of sugars to fat. Use warm water for drinking. Include lemon in diet and drinks. Then don'ts are high carbohydrate vegetables like potato, rice, these have to be avoided. More sugary or sweet products, more dairy products, fried and oily fast food, then excessive intake of salt. All these have to be reduced. And then, so this is about obesity. और इसके साथ, as I told you, there are many kashayams which are very helpful like Thaulehara Kashaya, Varanadi Kashaya and all. Next is hypertension. The burning problem of present day is hypertension, also known as high blood pressure. It's a long-term medical condition in which blood pressure in the arteries is persistently elevated. Basically, blood pressure का मतलब क्या है? It is the pressure exerted by blood on the walls of the arteries. So that is called as blood pressure. अगर blood pressure बहुत ज़्यादा होता है तो that leads to many problems, right? About 90 to 95% of cases are primary, defined as high blood pressure due to non-specific lifestyle and genetic factors. Lifestyle factors that increase the risk include excess salt in the diet, excess body weight, smoking, and alcohol use. The remaining 5 to 10% of cases are categorized as secondary high blood pressure. So, defined as high blood pressure due to an unidentifiable cause such as kidney problem like chronic kidney disease, narrowing of kidney arteries, an endocrine disorder, or use of BCPs or birth control pills. For most adults, normal blood pressure should be within the range of 100 to 130 millimeters of mercury systolic, that is numerator में इतना होना चाहिए, and 60 to 80 mmHg in the diastolic. For most adults, high blood pressure is present if the resting blood pressure is persistently or above 130 by 80 or 140 by 90 mmHg. Then blood pressure, look here, normal systolic should be less than 120, diastolic should be less than 80. Elevated is 120 to 129 systolic, less than 80 diastolic. High blood pressure stage 1 is 130 to 139 systolic, 80 to 89 diastolic. High blood pressure stage 2 is 140 or higher and diastolic is 90 or higher. Hypertensive crisis if it's higher than 180 and diastolic which is higher than 120. So आप शायद सोच रहे होंगे कि ये आयुर्वेद के दृष्टिकोण से इसे कैसे अंडरस्टैंड करना है. Yes, it is correlated to रक्तगतवात. रक्तछापा is a coined term. So इसका causes है heavy, oily, acidic, pungent tasting rich meals, excessive eating, alcohol intake, acidic and hot potency food, excessive sweet taste, sedentary lifestyle, day sleep, and smoking. So all these are some of the causes. We will have to identify what is the cause for the problem. So ये सब करने से क्या होता है? All these are considered as causes या निदान सेवन. निदान सेवन करने से हमारे शरीर में तीनों दोष प्रकोप हो जाते हैं, दैट इज दे गेट एग्रीवेटेड, और इसलिए मनःक्षोभ, इसके कारण इस कारण से मन तो वी स्टार्ट गेटिंग एजिटेटेड एंड इससे कफ या मेद की वृद्धि, सो कफ दोष एंड मेदो धातु बिकम्स टू मच. धमनियों में स्थान संशय, ये तो हमारे आर्टरीज या ब्लड वेजल्स में ये बिल्डअप हो सकता है. मार्गावरोध, अगर हमारा ब्लड वेजल इज नथिंग बट कैरीज ब्लड, ब्लड वेजल्स के मार्ग में ऐसा होने के वजह से धमनियों में स्थान संशय और इससे मार्गावरोध होने से देयर वोंट बी प्रॉपर फ्लो और चैनलाइजेशन ऑफ द ब्लड. इससे वात प्रकोप, व्यान वायु प्रकोप हो सकता है. व्यानवायु द्वारा रक्त के साथ मिलकर रक्त संवहन की मिथ्या गति, सो देयर वोंट बी प्रॉपर ट्रांसपोर्टेशन ऑफ ब्लड, और इसकी वजह से रक्तगतवात या फिर उच्च रक्तचाप होता है. सो दिस इज द आयुर्वेदिक वे ऑफ एनालाइजिंग दिस ब्लड प्रेशर. इसके लिए ट्रीटमेंट है शोधन चिकित्सा, विरेचन कर्म, लेखन बस्ती, रक्त मोक्षण. सो विरेचन is medicated purgation, लेखन बस्ती is scraping action type of basti, रक्त मोक्षण is bloodletting. Then शमन चिकित्सा में सिंगल herbs like अर्जुना, सर्पगंधा, भृंगराजा, जठामांसी, शंखपुष्पी, पुनर्नव, लशून, रुद्राक्ष, गुडुची, शतावरी. So all these are very helpful. Churnas are like sarpagandha churna, svirashta churnavati pill, sarpagandha, prabhakaravati, chandraprabha, and asava arishtas like arjunarishta, punarnavasava, rasaushadis like pravalpishti. All these, see, you have a very big list of single herbs and powders and some formulations very useful for उच्च रक्तचाप, that is high blood pressure. So these are all very useful. So you will have to consult a registered Ayurvedic medical practitioner so that you get a proper prescription. And yogasanas and pranayams are very helpful. Yogasanas, asanas like balasana, sukhasana, shavasana, bhujangasana, setubandhasana are very good. Anulom vilom pranayam, bhramari pranayam, shitali, shitkari, and om chanting, these are all very helpful. So this is about hypertension. Moving on to the next, that is diabetes. Diabetes को हम आयुर्वेद की परिभाषा में प्रमेह बोलते हैं. Also prameha, if it is taken as the early stage of diabetes, madhumeha is actual complicated stage. So prameha ya madhumeha is diabetes mellitus, commonly known as diabetes. It's a metabolic disease that causes high blood pressure, blood sugar. So हमारे रक्त में अगर ग्लूकोज का अंश ज्यादा होता है तो it causes this high blood sugar. The hormone insulin moves sugar from blood into your cells to be stored or used for energy. With diabetes, your body either doesn't make enough insulin or effectively cannot use this insulin. Okay, so क्या होता है कि शरीर में इंसुलिन जो है वो रेगुलेट करता है ब्लड में कितना ग्लूकोज होना चाहिए. ऐसा अगर एनर्जी के लिए ज्यादा ग्लूकोज चाहिए तो इंसुलिन इज द वन व्हिच इज रेगुलेटिंग, एंड if excess sugar is there in the body, in the blood, that shows that the person is suffering from diabetes. But still the person becomes weak. Weakness क्यों, किसके वजह से? क्योंकि शुगर है लेकिन इसका ठीक तरह का इस्तेमाल करना हमें पता नहीं है हमारे सेल्स को, इसके वजह से भी डायबिटीज हो सकता है. Untreated high blood sugar from diabetes can damage your nerves, eyes, kidneys, and other organs. So we need to take care. We should not allow the blood sugar diabetes to proceed further. There are few different types of diabetes. Let us see what they are. Type 1 diabetes is an autoimmune disease. That is, हमारा शरीर जो है it considers our system only as body components को enemy जैसे समझ के कुछ unwanted reactions it will start showing. The immune system attacks and destroys cells in the pancreas where insulin is made. It's unclear what causes this attack. About 10% of people with diabetes have this type of diabetes, that is type 1. Type 2 diabetes occurs when body becomes resistant to insulin and sugar builds up in your body. Pre-diabetes occurs when your blood sugar is higher than normal, but it is not high enough for diagnosis of type 2. So that is pre-diabetes, yeah, stage before actual diabetes. Then gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormones produced by placenta cause this type of diabetes, that is gestational diabetes. And most of the times pregnancy में जो diabetes problem होता है, it generally comes down. I mean, it is cleared after delivery. So Meaning of blood glucose. Just a minute, I'll take 1 minute break. So, meaning of blood glucose. Say this is a chart. So, it is very easy to understand from this chart. Oh, just a minute. It's quite easy to understand from this chart. Blood glucose level agar less than 53 mg per dl, then blood glucose levels less than 3 moles per liters. इसका interpretation है severe hypoglycemia, बहुत कम sugar, less than 70 blood glucose level 70 mg per dl, blood glucose level mmol per liter. If it is less than 3.9, it is hypoglycemia. Less than 125 and less than 7 is normal. Less than 200 and less than 10 is high. Take action. Between 200 and 500 or 10 and 27.7, it is causing some metabolic consequences. Then HbA1c score is nothing but 3 months average. So HbA1c score agar 4, 5, 6 hai, it is excellent. That mean blood sugar glucose level will be 50 to 115 mg per dl. Glucose 2.6 to 6.3 mol per liter. And then good if it is 7, 8, that is 150 to 180 mg per dl, 8.2 to 10 mol per liter. Poor if it is 9 to 14 and 215 to 380, 11.9 to 21.1. So this has to be properly understood. In Ayurveda, a condition in which a person passes honey-like urine is called as madhumeha, that is hyperglycemia. Honey-like urine in the sense, हमारे मूत्र में अगर color change हुआ है, like it becomes honey color, means it is madhumeha. Reduced insulin production and decreased insulin sensitivity are the contributing factors for hyperglycemia. It is one among 20 types of prameha, that is urological disorders described in various Ayurvedic classical texts, Charka Samhita, Sushruta Samhita. Ancient seers have narrated that excess use of guru snigdha, that is unctus, sour, salty food prepared from newly harvested grains, new wine, sedentary lifestyle, excessive sleep, lack of exercise, no chinta, that is no much of mental work, abstaining from samshodhana, that is purification, increased appetite, polyphagia, excessive thirst is polydipsia. So zyada pani pina, zyada urine pass karna और zyada khana, all these are 3 important typical features of diabetes. Turbidity in urine, debility or tiredness, weight loss, non-healing ulcer, visual disturbances, inflammation of glands penis. All these are some of the features suggestive of diabetes. In later stage of diabetes mellitus, the following complications may appear, like burning sensation, that is neuropathy over palmar and plantar region, boils and carbuncles, gangrene. So these are complications. General debility, retinopathy, so eye related issues, and then renal tissue damages, nephropathy, cardiovascular diseases, all these. So investigations जिनसे पता चलता है कि हमें शुगर प्रॉब्लम है, specific to disease are measurement of plasma glucose level, इसमें तो RBS, FBS and PPBS है, random blood sugar, fasting blood sugar and postprandial blood sugar. Urine routine and microscopy, glycosylated hemoglobin is HbA1c, lipid profile. Prevention, use of various preparations made from barley, green gram, old rice, bitter gourd, drumstick, methi, that is fenugreek, patola is snake gourd, pumpkin, cucumber, bimbi, that is ivy gourd, watermelon, buttermilk, triphala. These are beneficial as preventive measures for borderline diabetic patients. ठीक तरह से दिनचर्या का पालन करना, ऋतुचर्या का पालन करना बहुत इंपॉर्टेंट है. रेगुलर एक्सरसाइजेस, increase in calorie consuming activities like brisk walking, swimming, etc. Regular use of rasayana dravyas like amalaki rasayana, restriction in intake of sugar or sugar products, fried food and dairy products, restriction in use of different types of wine, excessive use of oil, clarified butter, milk, sugarcane products, cakes, and meat of domestic and aquatic animals. These are all some of the important things. Avoiding day sleep and laziness. So these have to be monitored properly so that we stay healthy for long years, isn't it? Any activities which are causing this problem should be avoided, like कफ दोष ज्यादा होने के लिए क्या क्या कारण हो सकता है, all these are डायबिटीज के लिए भी कारण होते हैं, right? And then line of treatment. So इसे कैसे treatment करना है? As you all know, निदान परिवर्जन, that is avoiding the cause, is the first line. So आपको tubers, sweets, dairy products, soft drinks, fried foods and sweet fruits like mango, banana, custard, apple, dates को avoid करना है. And then if patient is obese, then samshodhana chikitsa is important. Bio-cleansing therapies in the form of vamana, virechana, vasti are to be performed. However, this need to be decided by qualified physician of Ayurveda. If patient is lean and thin, then only Shamana Chikitsa is recommended. Drug therapy may, in Ayurveda, most of the drugs indicated in diabetes mellitus may act on beta cells of pancreas and thus improve insulin production or insulin sensitivity. The following drugs formulations are useful to control type 2 diabetes. In case of type 1 diabetes, these formulations may be used as supportive therapy in addition to conventional insulin therapy to prevent long-term complications. So, very useful herbs or useful ekamulika prayogas, in that means single herb that are useful are amla, turmeric, that is haldi, jambu, jamun ka chal, jamun fruit also. Meshashringi is gudmar, which I told yesterday. So ये मेषशृंगी का लीफ, एक लीफ खा के इसके ऊपर अगर हम गुड़ खाते हैं तो you won't feel the sweetness of good. Then methi, vijay sar, karela, all these formulations that are useful are nishamalakadi churna, trifala churn, and then chandra prabhavati, shuddha shilajatu, falatrikadi kwatha. So this is about diabetes mellitus. So today we have completed the class very soon. Almost 20 minutes early we have completed. So I will take up some questions and later on. Garima is asking, if someone has vata dosha, gas problem, should he try intermittent fasting? देखिए, अगर आप अच्छी तरह से इंटरमिटेंट फास्टिंग करते हैं तो गैस प्रॉब्लम विल बी गॉन. But the method, how you start and how you carry out, is very important. Is consuming lot of fruits daily safe for sugar levels in the body? See, too much is too bad because fruit also contains sugar. So you have to check the type of fruit that you are consuming. And then in modern nutrition, 3 to 4 servings of fruit daily is recommended. लेकिन quantity भी अच्छा होना चाहिए. See, we have given you some list of fruits like papaya, jamun fruit, then gooseberries. These are all very good fruits. Okay. Not necessarily to consume these more than that, more than the recommended ones, because see, only fruits से हमारा nutritional requirements पूरा नहीं होता है दिन का, एक दिन का. So इसलिए you will have to use everything, isn't it? So insulin patient को Ayurvedic line of treatment क्या होगा? Kamadhenu Ayurved Bhavan, they have asked this. Fruit which can be eaten in diabetes. As I told you, papaya, jamun fruit, apple, which is not very sweet, and some citrus fruits which are moderate, so they can be consumed. So insulin patient को normal line of treatment ही अच्छा होगा, like nishamalaki, arogyavardhini, and then vasanta kusumakara rasa, chandra prabhavati. These are very good. Okay, Kamadhenu Ayurved Bhavan. And then Brita. Can a diabetic person do intermittent diet? It's a bit difficult, but definitely they can try. Brita. Seema Sandeep, what we should do for lethargy? You should make up your mind and be very active and see to it that all your blood sugar levels, lipid profile, everything is normal. That has to be seen properly. Is long-term intermittent fasting safe? Yes, long-term intermittent fasting is actually safe. Example, 16-hour fasting daily between dinner and next day's breakfast. Doing this daily for long term, is it okay or should we do it few days or week? No, no, Vinita. Actually, 16 and 8 can be carried out for your lifetime. It's actually very good. This is how our ancient ancestors were actually following, because they used to never have the concept of breakfast, late dinner, and all. So always they used to have food that around as soon as they get up, they never had anything, isn't it? So it takes some time to prepare food. As long as the food is fresh and very normally home prepared, then definitely there shouldn't be any problem. So 2 meals a day is actually very good. Shine Ramakrishnan is asking, ma'am, I have slight high sugar. Doctor told me to stop cabbage. Is it okay? Cabbage does not interfere in with sugar. Actually, cabbage is very good. If at all thyroid problem is there, doctor would have advised you to stop cabbage. Then Nandita is asking, ma'am, then before intermittent fasting, before only our elders today us to have first meal before sunrise and last meal before sunset. No, not before sunrise, after sunrise. It is actually before sunrise, you can't have any food. So only it is after sunrise. Last meal before sunset is to some extent acceptable, but at least within 1 hour of sunset you can have, which gives best results. Actually, before sunrise, there is nothing told to be taken. So after getting up, minimum of 3 hours, you can't have your principal or major meal. Only liquids are okay, but other than that, no need to have anything. And please describe the use of giloy in obesity and hypertension. Yes, Soumya has asked this question. Very good question, Soumya. So giloy is a wonder drug. Take it from me. You can consider it as the queen of Ayurvedic herbs. That is giloy. So giloy is a climber botanically identified as Tinospora cordifolia. Guduchi is the Sanskrit name. In all other languages, it can be called as Amrita because there are many reasons. One is it helps us in getting good quality life, healthy life. We can stay away from diseases, isliye Amrita. And second is, if you have to grow this giloy, just take a piece of stem and put it in the soil and put water, it starts growing. So that means that there is no marana for that. You can just continuously go on growing this guduchi. So that is the importance of guduchi or giloy. So ओबेसिटी में गुडुची को हम जूस के रूप में यूज कर सकते हैं, and some tablets in the form of some shamanivati and all. The leaves of guduchi can be used in making some preparations, and hypertension में भी गुडुची का कषायम यूज कर सकते हैं, लेकिन गुडुची से ज्यादा ब्राह्मी अश्वगंधा are very good in tackling hypertension, right? Then Sonal Srivastava is asking, will it be okay to skip breakfast if we have 16-8 intermittent fasting? Directly have lunch by 11:30 or 12. Yes, definitely you can have some warm water before that. And yes, definitely it would be fine. This question was by Sonal. Vinita, what is giloy called in Hindi? Giloy is called as giloy only in Hindi. Is it safe for pitta people? Yes, it is very good for pitta people, of course. Okay. Then we have 15 more minutes. Any other doubts you have, you can just ask. It seems today we have a lot of time to discuss. Huh? Yes, let me just speak to one or two. Samir. Samir,
Yeah, good evening, ma'am.
Good evening. Namaste, Samir.
Namaste. Ma'am, anyone can take the Chyawanprash?
Yeah, Chyawanprash, a very good company. Chyawanprash is actually very good, but see the sugar level. Sugar related issues is there, then you will have to restrict the usage of sugar and I mean Chyawanprash. Nowadays, sugar-free Chyawanprash is also available so that you get the benefits of all other herbs. Okay,
And
so
what about ma'am Sona Chandi? Something like I saw that bottle on that they written that Sona Chandi
yeah, that
Chyawanprash.
is, they would add this Soneka Bhasma or Chandika Bhasma into this Chyawanprash. They're actually very good, no issues.
Okay, thank you.
But the product should be a genuine one.
Yeah, thank you,
Yes.
ma'am.
Sonal, sorry, Vinita. Vinita,
Hello,
hello, namaste.
namaste. I have a question. So I am a vegan. What can I substitute for ghee?
No, there is no substitution. I'm very sorry to say this. Our Ayurvedic concepts are like you might have heard of this permaculture, agroforestry in the olden days. It is like there is no substitute for that. You can't substitute anything else for ghee.
Okay. Okay. Another question. So I have Pitta Prakriti. Can I take flax seeds? Would that be beneficial?
Flaxseed, not too much because these sometimes they cause some untoward effect. To some extent, yes, you can have in moderate quantity.
Okay. And one last question. Can we combine fruits with other vegetables?
No, 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 never. We have given it in the list
Okay.
already.
So when we make smoothies, are those not considered an Ayurvedic preparation?
Smoothie is not a classical preparation, so better avoid smoothies. Whoever may say anything, smoothies like fruits with milk, no, definitely not a good combination at all.
And fruits with other vegetables, nuts, seeds, no?
No, 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 no.
Okay. And how
Simply,
about
you can have fruits. You can have only fruits. Now, why you want to combine with other vegetables or something else? See, simply trying for the sake of, these fancy items, they won't do good for a long time.
Okay.
Okay.
Yeah, thank you.
Thank you. Sonal?
गुड इवनिंग मैम
Good evening.
मैम मेरा क्वेश्चन ये था कि जैसे बोलते हैं कि आहार जो भी होता है हमारा वो प्रकृति के विपरीत होना चाहिए कि मतलब वो
No, no,
अपनी
no, not
प्रकृति
always. No, no, it's not like that. Our ahar should be such that it balances the doshas. That's all. प्रकृति के विरुद्ध हमेशा ऐसा कैसे हो सकता है, right? It's not possible. It should
तो
help in
मैम
balancing.
ओके मैम जैसे अगर हम किसी का प्रकृति पित्त एंड कफज दोनों है मतलब पित्त डोमिनेंट है एंड कफ कम अमाउंट में तो मैम हम फिर उसको किस टाइप का मतलब प्रिस्क्राइब करेंगे कि मैम क्योंकि वो दोनों तो ऑलमोस्ट अपोजिट उनके गुण होते हैं ना
But still, see what we say is the normal food, what is suggested by Ayurvedic, that is chawal, dal, vegetables, fruits. A normal diet, Hita Ahar is normally that which is good for everyone. And all these come under the category of Hita Ahar. Okay, so there are some exceptional vegetables like too much of bhindi with increased lot of kapha in the body. Too much of curds, especially at night, would increase lot of kapha in the body. Too much of hot and spicy substances would increase pitta in the body. That too much tag you have to just that prefix too much should be avoided. That's all. Everything in moderation is actually good. As we discussed, Shadrasopet Ahar, that is your Ahar, which consists of all the 6 days, would help in balancing all the doshas. So doshas would stay in equilibrium if you're having all the 6 rasas in a moderate quantity, not equal quantity, moderate.
ओके मैम, वन मोर क्वेश्चन। मैम जैसे बोलते हैं कि जो वृद्धाहार का जो कॉन्सेप्ट है, तो मैम जैसे बोलते हैं ना कि नमक और दूध साथ नहीं लेना चाहिए, बट मैम आज के ट्रेंड में देखते हैं कि लोग चाय एंड बिस्किट या फिर नमकीन वगैरह खाते हैं, तो मैम वो भी वृद्धाहार में आएगा?
Yes, it is Virudahar. Yes, exactly. You got the point.
ओके, थैंक यू मैम।
Biscuits is okay, but salted biscuits are not.
मैम पर नमकीन तो खाते हैं ना लोग चाय के
That is
साथ
what I'm
भी।
telling you. That is what. That is not good. If it is a sweet biscuit, that is okay. But salted biscuits and those chips and whatever, the packaged food and all, that's not.
ओके मैम, वन मोर क्वेश्चन। जैसे हम किसी भी पेशेंट का डाइट प्लान करेंगे, तो जैसे अलग अलग परीक्षा जो बताई गई हैं, त्रिविध, चतुर्विध, पंचविध वगैरह, तो मैम मतलब बेस्ट परीक्षा कौन सी होती है कि हम उस बेसिस पे हम डाइट प्लान करें?
नहीं नहीं, परीक्षा तो आप इस स्टेज में नहीं कर सकते हो, बिकॉज इट रिक्वायर्स लॉट ऑफ मोर एक्सपीरियंस एंड लॉट ऑफ रीडिंग फर्दर मोर. Okay, pariksha, what we have discussed here is for your information. Probably in advanced courses you will have further advanced or improvised form, which would be easy for you to understand and use. So all
Ma'am,
these,
actually-
we as Vaidyas, we use all these methods in diagnosis.
Ma'am, actually I am a BMS student, that's why I am asking that
Ah.
which will be the best one for diet planning.
For diet planning, is it? See, diet planning ke liye, yes, Dashavida is to be considered.
Dashvid, okay.
Because
Not
there
as-
practically everything comes, na. Ashtasthana
Yes,
may
ma'am.
not be of much help in that condition. Dashavida pariksha only has to be considered.
Okay, thank you ma'am.
Thank you so much. Then Kamdhenu. Sonal, I think I spoke to you, right? Kamadhenu Ayurved Bhavan.
Good evening, madam.
Namaste.
Namaste, madam. In diabetic, India is going to be the capital in the world, where all the treatment is there. All should know what to eat, not to eat. All the treatment, Ayurveda, allopathic. तो ये डायबिटिक अभी इतना इंडिया में बढ़ क्यों रहा है? क्या रीजन है और इसको हम कैसे रोक सकते हैं?
Following healthy lifestyle.
ये सब जानने के बावजूद भी मैडम इसका फिगर बढ़ते जा रहा है एवरी ईयर।
जानने के बाद क्या प्रैक्टिकली अडॉप्ट कर रहे हैं लोग? थिंक अबाउट दैट. सिर्फ जानकारी काफी नहीं है, अडॉप्ट करना इम्पोर्टेंट है ना?
तो क्या लोग अडॉप्ट करना नहीं चाहते हैं? तो जानते हैं कि भाई डायबिटीज हर घर में होने जा रहा है और हो भी रहा है, तो इसका अवेयरनेस कैसे इसका पॉसिबल होगा? बाय गवर्नमेंट और बाय ट्रीटमेंट.
There are so many movements that are going on. SDM, Stop Diabetes Movement, Madhumeha Mardhan, all many movements, many group of people creating awareness regarding diabetes. How do you say it is not working? It is, if it is acceptable, if it is adaptable, then people would definitely stay away from that, isn't it?
हाईएस्ट कैजुअलिटी तो डायबिटिक की वजह से इंडिया में भी फिगर हो रहा है ना?
हो रहा है. आप लोग अवेयरनेस क्रिएट कीजिए ज्यादा. मेक पीपल अडॉप्ट हेल्दी लाइफस्टाइल.
हम अवेयरनेस तो सब कर रहे हैं, गवर्नमेंट भी कर रहा है, उसके बावजूद ही इसका फिगर जो ग्राफ है हर साल बढ़ते जा रहा है. तो इसको कैसे रोका जा सकता है? ट्रीटमेंट इज देयर, सब जानते हैं, फिर भी नहीं हो रहा.
People are not seriously, no, that means people are not seriously following all the rules and regulations that have been told. How many people are aware about the Ayurvedic aspect of diabetes? Think about it. Okay.
Okay, madam. Thank you, madam.
Smriti Agarwal.
Yes, ma'am. Ma'am, my question is that, namaste, ma'am. Ma'am, normally with milk, salt is not suggested by Ayurveda. I mean, if you are having breakfast, we should not take milk with that. We should not combine fruits with milk. Then, ma'am, what is the right time to have milk other than bedtime milk?
See, there are, according to different doshas, like if you are a Pitta Prakriti person, having milk midday is actually good. If you are a Kapha Prakriti person, then adding some turmeric and pepper and all these evening is a good time for milk. For others, Vata Prakriti and other people who do not have this Kapha related problem, they can have milk at night.
They can have milk at night.
Yeah. For those who have very good Agni, they can have milk in the morning. But for those who have less Agni, they can't have milk in the morning, early morning. Okay. So depends.
So ma'am, that means
Depends on.
suppose in breakfast, if I want to have milk in breakfast, then then it should only be milk.
It's always better if milk is consumed alone. I mean, it should be relished singly. Do not combine it with other things, except like in kheers or in dry fruit shakes and all, that's okay. But not with anything that is sour or after breakfast or something like that. That's it.
Thank you, ma'am.
Ria.
Hello, ma'am.
Namaste.
Namaste. I want to ask that someone had told me that after 3 p.m. I cannot drink any shake or any fruits. Why?
After
3 p.m. After 3 p.m.
No, not 3 p.m. After 6 p.m. After sunset, try to stay away from fruits, raw things.
Okay, and mostly in nutrition and even Ayurveda, mostly they are considering more of obesity and overweight, but they are not
just obesity and overweight. It might cause increase of kapha dosha in the body, and that is why we are saying that. Okay.
What about weight gain? What about weight gain?
वेट गेन करना है तो न्यूट्रिशियस फूड ले लीजिए, फ्रूट्स भी ले लीजिए, लेकिन रात में नहीं. दैट इज व्हाट वी आर ट्राइंग टू टेल. It might cause some doshic imbalance. Don't think only about obesity we are talking about. Okay, nutrition class, Ayurveda class, they're talking only about obesity. That is why they are telling us not to have fruits in the evening. No, that is not the reason. Reason is it might increase शीत गुण in the body. शीत गुण से वात दोष या फिर कफ दोष बढ़ सकता है. आपको तकलीफ हो सकता है गले का कुछ या फिर कुछ अदर इश्यूज डाइजेशन रिलेटेड. इसलिए हम बोल रहे हैं कि फ्रूट्स को सनसेट के बाद कंज्यूम मत कीजिए. दैट्स इट. ओके.
Last question is like coffee, most of like normal temperature also, after boiling of normal temperature also, when I drink the coffee, so my tongue becomes fully red and it takes 2 days to recover.
Don't drink coffee.
I drink only cold coffee, like cold nothing will happen, but hot or normal temperature of coffee, it will like suddenly
So that shows that you are of Pitta Prakriti. So that is why do not have things that are very hot. Okay. Yeah. Thank you. Next is, so last person will be Palak.
Yeah, ma'am. Good evening. How are you?
Yeah, fine.
Yeah. So, ma'am, according to I access my dosha, so I think I'm from a Vata. My dosha is Vata. Okay. So, what I do that in the evening, because I'm doing a working, I'm doing a job. Okay. And so 8 hours I have to continuously sit on a laptop. So, what I do that in the evening, I consume milk with cornflakes. So, is it okay to combine both of these things?
Cornflakes generally we don't advise, but combination of milk with cornflakes is not bad, but don't add fruits. That's it.
Yeah. Only basic that cornflakes and this along with that shakkar, not sugar.
Okay.
And also I feel like I'm prone to disease like this cold, very frequent. When my mother gets sick, I used to be the one person in the house who used to fall sick. So what should I do for that?
You will have to take some immunity boosting lehyas. like Chavanprash, Chitrak Haritaki, Agastya Rasayana and all. So you need a consultation probably. Get in touch with our coordinators. They will be able to connect you with the specialists and definitely will be able to help you. Right?
And one last question, ma'am. Thanks a lot. And what can I consume for my eyes? I mean, there's a lot of pressure on my eyes. I have to continuously work. So what should I consume?
See, for this, there is a medicine by name Saptamritaloha. So 2 tablets of the Saptamritaloha along with ghee and honey you will have to consume. Wash your eyes with Triphala Kashayam at least once or twice a day. And then there is a procedure by name Akshi Tarpana or Netra Tarpana. You can get that done. That is a 7 days procedure. That is actually very good for improving the health of the eyes.
Thanks
Right?
a lot, ma'am. Thanks a
Thank
lot.
you so much. Nice talking to you, Palak.
Thank you, madam.
So, one question. Shine Ramakrishnan is asking, Ma'am, Mosuru Anna is good for digestion. That means curd rice. He's talking about curd rice. So, curd rice, if it is consumed in the afternoon, if the curd is not so cold, generally, yes, it is okay, but not at night. Then Dr. Shail is asking, diabetes person को बार बार भूख लगती है, ऐसा क्यों होता है? Yes, that is a typical symptom of diabetes that happens because even though glucose is there in the body is not able to make proper use of this glucose. इसलिए ऐसा होता है. That is the pathogenesis basically. Yes, and then Kamdhenu is asking, can insulin patient reverse the diabetic? How many days it will take? It depends on the seriousness. It depends on the complications, everything. So each patient is different. So every person is different from another. So if proper guidance is taken and if the person is also able to follow it properly, definitely to some extent we can assure, but totally reversible, I don't see. Right? Thank you so much, because it is not a disease like fever or throat pain. Diabetes is a metabolic disease. It takes a lot of time. There can't be any time limit for that. You can't say, itne time span mein ye ठीक हो सकता है. You can't say that, right? So genetic factors, the lifestyle, everything matters over there, right? So saying this, myself, Dr. Pratibha, I'll be signing off. I wish you all a very happy evening. Keep reading. Be prepared for tomorrow's class. Come with the paper and a pen. We'll have nice discussions tomorrow also. Right. I'll be meeting you all at 5 o'clock sharp. Thank you so much. Namaste.